and welcome. Thanks for attending our workshop today on how do I know when my child is making progress in special education. I am sure many of you, like myself, are blessed with a snow day and all of your kids at home as well. So this will be a very fun-filled hour for us all. Let's see, we're at about 30 people. So I think we'll kind of get started with the fun stuff and then we'll dive right into the workshop. So welcome. How do I know when my child is making progress in special education is our workshop today, and we're happy you are here to join us. So, sorry, now I'm realizing Sarah and I practiced this and all the technology went right out the window. So now we're on the fly here. Today's workshop will be focused on understanding educational outcomes for students in special education. IDEA guidelines that requires schools track educational progress for children with disabilities. This is a new workshop. It's been created around questions submitted during your registration. And if you have questions along the way, feel free to place any relevant but general questions in the topic in the Q&A box below. If you have a question that's very specific to your child or situation, we can best serve you by reaching out to a PACER advocate directly by contacting PACER through our main contact page. And all of that information is provided in our at the end of the webinar as well. So again, general questions, we will do our best to answer. And I am Colleen Cascudo. I am a parent advocate and trainer here at PACER. I've been here about 3 years. I have 3 children, 2 of whom have disabilities. They have been on IEP since they were 3. I've sat in special education meetings as a parent and educator and learned the importance of knowing my rights along the way and how to prepare for to advocate in these meetings for my child's needs.
And my name is Sarah McGinn, and I'm a parent trainer and advocate at PACER. Coming up on my year anniversary, feels a little bit longer. Prior to that time, I worked as a special education para in elementary school as well as in preschool. I really enjoyed working with students. I had a passion specifically within my work, understanding behavior. I have 3 boys of my own. They're all teenagers or young adults. And throughout their school years, I found myself blindly advocating for one of them. So it's through that personal experience and work experience that I came to PACER to help parents navigate and understand the supports that are available to their own children. Let me tell you a little bit about PACER Center. We are a trusted source of information, training, and support for families of children with disabilities. Our services help families and youth navigate special education and other complex systems, discover assistive technology solutions, and we help parents access bullying prevention resources. We are the only organization in Minnesota that provides support for families of children and youth with any disability from age birth to 26, and PACER services are provided free of charge to Minnesota families. Something PACER is not is a legal services or so PACER staff do not act as attorneys and we cannot give legal advice. The content of this presentation or related materials are for informational and educational purposes only, and it is not, and if you do need any legal advice, you should contact an attorney. We like to share special events that support the work that we do here at PACER Center. This is an upcoming opportunity. It's a new format for PACER. It's the 2025 PACER Gala. It will take place on Saturday, May 10th at the JW Marriott at the Mall of America. You can learn more about purchasing tickets, perusing the silent raffle, and all the event schedules by scanning the QR code up here, or by checking the website for more details at www.pacer.org. We hope you can join us or participate.
So right before I dive in, I just want to remind people joining that our webinar today has been developed based on questions that you submitted when you registered around goals and progress. If you do have further questions, we will do our best to answer them along the way. And by putting your question in the Q&A, please do not go into very specific details. Keep it as general as possible. For more specific situations, we ask that you contact PACER and speak with an advocate directly. Again, these are just generic questions overall around progress. So nothing specific to you. Okay. So here we go. IEP goals. In order for guardians to understand if their child is making progress in special education, it will be helpful for you to understand what an IEP goal is. An IEP goal is an instructional goal that describes what your child is expected to accomplish within the 1-year period of the IEP when provided with special education instruction and related services. They are created using the present levels of academic achievement and functional performance, or my favorite acronym in special education, the PLAF. After an
Thank you.
evaluation determines that the child is eligible for special education. From that evaluation, any and all of the identified needs are addressed in the IEP. And for some of them, IEP goals are created to support skill building in those areas. The IEP is designed to provide access to instructional strategies and curricula aligned to both challenging state academic content standards and ambitious goals based on the unique circumstances of the child. The areas of the development that can be addressed using IEP goals could include academic, behavioral, functional, social, or other skills that are important for your child to master. The IEP will discuss the skills that need to be learned or behaviors that need to change, which is using data and information from the team, where the child is now in that skill or behavior, the rate of progress the child has shown in the past, and the ending level of performance that can be satisfactorily achieved and how that performance will be measured.
Okay, next we're going to talk about what should be included in an IEP goal. Uh, the first thing is objectives. Objectives are the steps leading to the accomplishment of a goal, and benchmarks are signs that show development of the skill or behavior. For each objective, it should include the skill to be performed, conditions for evaluating that skill, criteria, and the evaluation procedures that will be used to measure. The goals must be measurable so that the IEP team will know if your child is making progress on each one. This can be accomplished by making sure the goal includes a clear beginning or baseline level and then expected ending levels. You will often hear wording such as from a level of to a level of. This level may be found in the goal itself or in the present level statement, which is found either at the beginning of the IEP or sometimes within the goal itself. Another important part of the IEP goal is a statement of how the goal will be measured. Some examples of measurements over daily work samples, teacher observation, monthly paragraphs examples, and behavior charts and or data sheets. For example, if the IEP goal states the goal is to increase Jasmine's level of producing organized paragraphs when a given subject by her teacher with correct spelling and punctuation from 50% of the time to 90% of the time within 1 year as measured by monthly paragraph samples. The skill in this example is producing organized paragraphs with correct spelling and punctuation. The conditions for evaluating could be when given a subject by her teacher. The criteria is 50%, which is the baseline, to 90%, which is the goal over the course of the year. And that is determined, that amount of progress that they anticipate that child can make is determined by that IEP team when creating that goal. And the measurement could be stated as measured by monthly paragraph samples in this example, or examples in this example.
So now we're going to talk about data. All teachers and staff love data.
Mhm.
If your child participates in regular education classroom for all or any part of their day, you can request to meet with the teacher if you are concerned or have questions about your child's progress. This could include conferences, daily work samples, test scores, and or report cards. Children with disabilities have the right to participate in district and statewide assessments as appropriate. Some IEP teams may determine and document that accommodations are necessary and appropriate for a particular student given their identified needs related to testing. District-wide assessments include tests which compare the academic achievement of students across grade or age level. You can also use these tests to see if your child is making progress when the test is administered from year to year. You can find out what district assessments your child takes by asking your case manager or getting a copy of the results to review. So that would be something like the FastBridge, which is pretty common here in Minnesota.
Mhm.
Statewide assessments such as MCA or MTAS, which is an alternative assessment for students with the most significant cognitive disabilities in reading, math, and science. They are designed to ensure educational accountability in schools across the state. The results help schools and districts identify strengths and weaknesses in curriculum and instructions to schools, and they can adequately prepare students to meet the state academic standards. These scores can indicate how your child is progressing in the skills needed to meet Minnesota's academic standards.
There are also types of data within the world of special education. Special education data is another valuable source of information when determining appropriate IEP goals and measuring progress. The results of the student's most recent special education evaluation can be an important tool that identifies a student's present levels of academic achievement and functional performance for the class. It looks at cognitive and behavioral factors, as well as physical and developmental factors in all areas of suspected disability. Since the evaluation is a baseline for IEP goals and progress measurement, it is important that the evaluation be a complete, comprehensive, and accurate picture of your child. Parents can use the evaluation and compare it to past evaluations to gauge your child's progress. Your child's IEP must include measurable annual goals. For each goal area, the IEP records their beginning level of performance, either in the plat, which is those present levels, or the goal statement itself. It must outline the skills or behaviors that need to be changed, the direction of the desired change, and the expected ending level of performance. You will receive reports outlining your child's progress in something called a progress report. And the progress reporting is noted usually on that first page of the IEP, towards the bottom third, and it will tell a family how often that progress will be reported to you and how. Progress reports will include how annual goals will be measured and how you will be informed of the progress. Parents must be informed at least as often as their non-disabled peers are. For students on an IEP, another report often includes a discussion about the progress on the IEP goals at their annual IEP team meeting.
So there's other types of data. A parent has a valuable input and observation specific to home and community environments. Does the child have school avoidant behaviors in the morning? Do they struggle with restraint or collapse or meltdown when they get home from school? Do they struggle with routines or changes in routines? Parents can share data from tutors with the IEP team, if applicable to the IEP goals, or specific skills they are targeting with outside supports. Outside supports could be private, OT, and speech, or any other private providers. It can be helpful to keep documentation of any concerns that you may have. Daily work samples can provide a parent with knowledge of a student's day-to-day performance. Another important source of information is what homework time looks like for your child. Does it seem to take an appropriate amount of time? Do they struggle with task initiation, planning, work completion? Do they shut down when confronted with homework? Do they require a lot of supervision and support for their age? These questions can help a team understand what accommodations and modifications may be helpful to address any concerns. Independent evaluations can be completed from a variety of sources. For example, a neuropsychological evaluation is a diagnostic test that gives parents a lot of similar information as an educational evaluation. But instead of looking at how those needs impact a child at school, it gives a diagnostic criteria and or medical diagnosis to families, as well as recommendations and resources given the results. Outside therapists like OT, speech and language pathologists, PT, and other private service providers can also give valuable information to the IEP team. It is important to note, however, that a school only needs to consider the information shared with the team, but not required to do so.
Okay, the next slide here is going to talk about what if you have a concern that your child is not making progress. If you think your child is not making meaningful educational progress, you have a couple of options. You can review the IEP goals and progress reports to determine the rate of progress, and or review the IEP to understand what services and supports are currently being provided to your child to support all of their identified educational needs and look for any potential gaps in services. You could also request an IEP team meeting to discuss any revisions to your child's IEP. It is important to note that the school cannot guarantee that a child will achieve the goals in the IEP. However, the school must make a good faith effort to assist the child to do so. Whether or not progress is meaningful will depend on what the IEP determines as the goal and what the progress they believe is achievable within the year on that goal with appropriate accommodations, modifications, or services.
So an IEP team meeting can be held to discuss and plan revisions to improve your child's opportunity to make progress. Your child may need changes in special education or related services, assistive technology, curriculum or method instruction, and educational setting. If your IEP team cannot agree whether your child is making meaningful progress, additional evaluation data may be needed.
Okay, we have reached the end of our workshop slides. And so what we'll do is we will move into our previously shared questions and answers. And then, so if you have any additional questions related to the topic, this would be a good time for you to enter that into the Q&A box here. And so we have one question here, which I'll start with. It says we have IEP team meetings, viewing progress reports twice a year. Are we able to request more? So like I had said in the during one of the previous slides, that you can find how often and how that progress will be reported to you on that first page, typically of an IEP. Oftentimes included in that time is one discussion at that IEP team meeting that happens annually. And then sometimes families will see, another one or two written progress reports, and they will receive those either in the mail or in email form or through a backpack. So a parent could ask for more progress reporting. However, we want it to be sustainable for both the teacher and the team that's working with the child. So that's something you could discuss at an IEP team meeting, and you could ask that that be increased or include some sort of communication that happens more frequently if you're concerned about progress.
So one of the questions that was submitted during registration was when goals stay the same and progress stays the same, is it fair to dismiss the goal to make room for new goals? Excuse me. Um, so I think the first thing you want to look at is when was that goal created and what were the needs identified when making that goal. When you have a goal, you also have objectives underneath it. So you kind of have, how do we know we're making progress toward that goal? If you are stalling and things are not moving along, then yep, it's up to have an IEP team meeting and say, we're not making progress. Our rate of progress is not that strong. Do we need to revise this goal? And it can either be revising it to make it more attainable, where if we're not going as fast as we thought we would, we could take a step back and say, okay, maybe instead of 75%, we bring it down to 60%. So it's up to the IEP team to kind of have that discussion with you and say, do we need to revise it to make it more attainable? Do we need to look at a different I think to throw it all together might be a bit extreme depending on circumstances. But how do we revise it so that it is an attainable goal, that we can be making progress towards it? What needs to be, I kind of refer to it like an etch-a-sketch. How do we shake it up and start over so that we know we're making progress or we're getting somewhere towards that?
All right. I'm going to answer a question that was just sent over, but it was also kind of the basis of a couple other questions that we received prior to our workshop opening today. But do you have any, here's the one that I received earlier. Do you have a suggestion for a daily or weekly progress report for a nonverbal child? um, as well as my child is limited verbally and won't be able to tell me the account of his day. How can I be sure he is receiving the services as planned? So it can be really helpful for families during that time together at the annual IEP team meeting in this specific situation to discuss a communication plan that can take place between the family and the case manager. This can be documented in the accommodations of that IEP. And you want to keep in mind that that plan, like I had said earlier, is sustainable for school staff. You could ask for sometimes that looks like a weekly check in, a communication log. And sometimes in those accommodations, it specifically sets parameters for when you would like to receive more information on something specific. So an example of that would be if for some reason, whether it's due to staffing or snow days or, those circumstances where maybe a child did not receive their services, it might include a plan for how those missed services are communicated to the family. By doing so and having that communication plan, that can help build and keep trust between the team members and fosters collaboration as you guys work together throughout the school year.
Now, another question that came in is how often are we able to request an IEP meeting? It can be more than once a year. Is that correct? Yes, you absolutely can ask for an IEP team meeting at any time. What I would say is why? What's the who, what, when, where, and why around it? Is there a concern with your child? Are you just looking for progress reporting and then you want to have an IEP meeting around that? Or are there concerns? And that's usually when you ask for another IEP team meeting, is when you look at your team and say, you know what, I need all these people at the table so we can have a conversation. And it's usually something is bubbling up. There's usually a new concern, or maybe it's we don't need the service anymore. Whatever you feel that concern is, we kind of use this strategy with parents of saying it's your job to kind of state the problem. What is the problem that you feel is going on? What data do you might have that says, yeah, I think we really need to look at this, and I need my IEP team to have that conversation as to we need to come up with some solutions. So it's often the parent or guardian's job to kind of state that problem that they're seeing, that they feel like they're experiencing with their student at school. And then the IEP team should be working together to kind of come up with some solutions. And it can look like it's a different solution for each person at that table, whether it's an OT or a school psychologist or a guidance counselor or speech. Each one of them there has a different role, just like a parent. So I think the question would be, what concerns are you having with school? And then, yep, you would ask for a meeting with your case manager and say, I'd like to have an IEP team meeting at this time to discuss, these are my concerns. And let's have a conversation around those.
All right, I'm going to follow up that with another pre-received is not a word, but a question we received prior to the workshop. And that question was, how often should I check in with the team to understand progress? So I'm answering this with the assumption that that team is that IEP team. However, if your student also has general education teachers, if you have concerns about progress outside of those normal conference dates, that would just be a good time maybe to send an email to the teacher with an expectation to give them some time to appropriately respond to that. If you would like information about progress on IEP goals, that's where you could reach out to your child's case manager. And like Colleen had just kind of said, based on what concerns you have, and if progress is one of those concerns, a really good practice is to first review your evaluation and IEP to make sure that you have a full understanding of what those services are to be provided, as well as those progress reports to see if those can help answer your questions. And then sometimes just those clarifying questions to case managers can be really helpful. Learning more about the IEP process and understanding that IEP helps you understand what the school's obligations are to your child and helps support your parent advocacy. If you have any questions more specific than that, you can reach out to an advocate and we can help you. Some other forms of progress that you could check in with the team about if you know that maybe those emails or those verbal conversations are difficult or harder to accomplish is written communication plans. So sometimes an accommodation can be written like a home to school notebook provided with daily written communication between the parent and the school. It's best to keep them brief and manageable, and ask specifically what your child needs, and kind of how what you would like that to contain. Meeting notes and follow-up notes to any conversations can be helpful. Ask if someone is taking notes prior to a meeting so that you can request a copy of them for referring to later on. And phone logs. And we always recommend, just in general, that anytime a family has a conversation, whether that's progress or other parts of your child's IEP or your concerns, that anytime you have a conversation, you keep that in writing by following it up with an email kind of outlining what you understood from that conversation and any action steps you guys discussed. Um, Another thing that kind of, when you're checking in with a team about progress, if you're hearing information from a teacher or a case manager and it feels more like an opinion, it's another great strategy for parents to ask for data and to show you the data and provide that to you, that supports kind of what they're saying.
So quick one here that kind of came in that's just a little bit about PACER in general. It's kind of, what is our role as a parent, advocate, and trainer, and how did we get into it? Well, that's a whole nother story for a whole nother day. But what I can tell you is our role as parent advocates. We do not attend regular IEP meetings. I kind of feel like our role is, when a parent contacts us and they have questions or concerns, our role is to help you understand your options using everything that's out there, all the tools in our toolbox, in your toolbox. What options do you have as you move forward? Is it a concern, question? Sometimes people are contacting us and things are really feeling like they're ready to explode. Other times it's kiddo who is just evaluated and qualified for services. So we get questions from all ends of this rainbow. So our job as advocates is to help you understand your options, to understand where you are in the process, what next steps are available. It's your job to figure out which way you want to go. Do you want to go left? Do you want to go right? Do you want to go center? But we explain to you what those look like. The only times we do attend meetings are when it's kind of like the bigger dispute where no one's in agreement on IEPs or things like that. But that's kind of what our role is as parent trainer and advocates. We also design these really fun workshops and have fun with that. So that's kind of our role here at PACER. And then to kind of go off of that, my next question that came in, oftentimes the progress report says that a child is making progress. However, when I test them myself, I see differences. So I think I would be really looking at, what exactly is that goal saying? What exactly are they, what is the goal on the IEP? What are those objectives saying? And then I would really be contacting the teacher to find out, well, how are you working on that? What strategies are you using? And, I kind of think about my daughter who is in third grade and how many different ways they taught them how to add and subtract and regroup. Like carrying is no longer a term that I learned when learning subtraction so it's like, what method and what strategies is the school using? What is the objective of the IEP goal? And then are you using the same terminology as the school? Another example, I would always say times when I ask my kid, what's 4 times 3? And she's like, I don't know. I'm like, okay, what is 4 multiply 3? Like apparently even the word times sometimes is not a thing. But to say multiply instead, that did it. That's what she needed. So I think it's kind of figuring out, how are they teaching it at school? What strategies and supports are they using? And are you both on the same page? Because then I think that matters.
Yeah, and to add to that, I feel like sometimes when I hear that difference between parents and at school,
Mm,
it's a great opportunity to look through a window of what else could be contributing to
mhm,
difficulty. At home, what does that environment look like compared to school environment when they're doing the same work?
mhm,
Oftentimes, a student, but we'll use a third grade math student, since Colleen was using that, they're trying to do that, um, process that information with maybe lots of noises and lights and distractions. And so if you're working with your child at home, it might be easier for them to be completing their math homework because it's a quieter one-on-one setting. So sometimes if you're noticing that difference, it might be helpful to also kind of open up that to the team and say, does my student maybe require an accommodation for a quiet workspace so that they're, do they have, right now, are they working in a small group on those skills? And just some of those other help it kind of cue you into maybe what are some of those other needs that your student might have that those different environments can kind of point out to you. I have another question, and this one I see a lot of personally in my work at Pacer, but is about tracking progress towards behavior goals, or with students with challenging behaviors. Um, so it is important to know that students with disabilities are generally held to the same behavior expectations as their general education peers, unless their 504 or IEP team details modified expectations and consequences in that individual plan. If a student has a behavior plan, which often comes from data that is collected during a functional behavioral assessment, that is a type of assessment that is completed all on its own. It can be completed as part of an evaluation, and it looks and collects data about the function of a challenging behavior that's occurring at school. It looks at when it's occurring. It should also look at when it's not occurring and be collecting data in those different times and environments to just kind of clue the team in about what those antecedents are and how they can appropriately and consistently respond with that data in mind. You could also discuss with your team, how are you collecting that data, how that's going to be shared with you, and what those target behaviors are that they're looking at. And that's kind of when you have more specific information, whether it's a skill they're working at, whether it's those needs that need to be met, kind of identifying both of those things can help you track progress much in the same way as an educational goal, but they work very similarly. So kind of goes back to, is the behavior is the goal for the behavioral, that behavioral based goal, is that goal appropriate? Can they achieve that within the next year? And what is that going to look like and how we're going to measure that? You can have an IEP team meeting, as we've been saying consistently through this webinar. If you have any concerns about challenging behavior, you can reach out to a PACER advocate. And then something to note is partnerships are dependent on clear communication. I think when children, are struggling with challenging behaviors in the classroom, it's really helpful for that parent to kind of help the team understand we need to look at that behavior as communication. Do they have unmet needs or skill deficits that maybe they're not able to utilize? And having that good communication plan between home and school can help reduce the misunderstanding, and sometimes those concerns can be really difficult and those conversations can be difficult for teens. So it's very important, because sometimes those kiddos that have those, behavioral needs need more in-depth help and support in some of those areas, which can then sometimes, make that relationship feel a little strained at times.
So just again, if you have any current questions, please feel free to put them in the Q&A. I know I only have about 2 left that from our pre-sent in questions. Sarah, I'm not quite sure how many you have, but I know we also have about 20 minutes. So if you do have any questions or concerns around progress, measuring progress, or anything else, please feel free to put it in the Q&A. We'll do our best to answer them, again, as long as it's not too specific, just to make sure everybody is getting what they need.
Clean.
Yes, ma'am.
I'll just finish. So since we have a little bit more time, I do have some. So when I work with parents specifically, I really like for parents to think about addressing their concerns using questions. And I made a list here off of one of our resources. There's some really great questions that you can consider asking specifically with, that challenging behavior and, and that communication piece, which can include progress monitoring on those behavioral goals. But some options and some examples of questions that parents could ask is, how will the staff communicate with me? Under what circumstances will I be called at work? So oftentimes we have families where their students are, having challenging behaviors at school and they get called to pick up their student. So sometimes having those accommodations can help or have that behavior plan, it can kind of be written into that so everyone's really clear about when that happens. Um, how that communication, and this could be with progress monitoring for educational goals too. If a parent doesn't have access to phone, email, or texting, making sure that both parties are able to have that conversation through a means that both have access to. So some of our families, that telephone conversations are difficult, so just making sure that you're being very open about that with the team, so that the information you are getting about progress, or any questions that you have, is one that you're going to be able to have that accessibility for yourself.
Okay, we got a new question that came in is what is the latest we can request an IEP meeting in the current school year? A new concern has surfaced. Is it too late to add to the current IEP? So a couple of things to kind of break down there is if you're asking for an IEP meeting, that means there is a concern that you want to address with the whole IEP team. So that's the whole reason why you're asking for the whole team to come together. If it is just a concern you have with a case manager or a gen ed teacher, sometimes you can just ask to meet with them directly. So if you're asking for an IEP meeting, you're asking for all the team members to be present. So when you're asking them to be present, you're saying a new concern has surfaced. So it's really important to kind of state what is that concern that you're seeing? What data do you have to kind of say, yep, this is a problem that we're having. How can we work together to solve it? In regards to late time of year, I know it's March and I feel like June will never come, especially with the 6 inches of snow we just got. But a couple of things to consider. I think, spring breaks are coming up or have already started. It really depends on what you're asking. Yes, they can make, you're requesting an IEPT meeting. They're going to be working together to get all calendars aligned to find a time to meet, whether it's 20 minutes or 30 minutes. Um, kind of thinking of putting my old teacher hat on for a minute. I'm thinking April and May is very busy for teachers because they are doing all those transition meetings. Um, so just know it might take a little bit longer during those times. Transition meetings is when your kiddo is going from preschool to elementary or elementary to middle when you're having those big building shift changes. So that's kind of that is a big time consuming factor for staff. Um, but again, March, I mean, we still do have a long way to go till June. So I think definitely, again, putting your concern out there, is there a way we can meet? Zoom is now everybody's friend. It's kind of easy to throw together a Zoom meeting and get the right team members to the table. It's just being very specific as to what is it that you want to discuss? What concern are you seeing? And how does that involve the team members? So if you're thinking about adding something to the IEP, well, then we got to think about data. What data do we have to support that this is an identified need? Not so much a concern bubbling up, but what data do we have to support changing an IEP? That's a big team decision. Um, so it's not so much changing the IEP as how is a team going to work together to solve the current problem that you're seeing with your child. So I hope that answers your question.
All right. I have another question that was previously submitted, and that is, I don't feel like my student is being challenged to learn and has regressed with his reading or comprehension. The first step when you have this concern, Colleen was just saying, sometimes at the end of the year, this can be a little more challenging, but is asking for that IEP team meeting. Um, if your child receives special education, this allows you to bring those concerns to the team's attention and determine any changes in their services or supports that might be needed. This is where it can be really helpful to call and contact a PACER advocate. This can I can help kind of elaborate a little bit more on what our role is. And so when a parent calls with this concern, something that we do with parents is document reviews. So we help the parent look through the evaluation. Was that need identified? What was their present level in their IEP? And then we can look through progress reports to determine, does that progress report have a good baseline? Does it have an appropriate expected end result? Does it have really great measurement pieces in that IEP goal. And when we do those reviews and we do that with parents, the intention of that is to teach the parent how to understand that information, how they're related, and then how to present that concern to their IEP team. So if you ever have any concerns in this way, whether it's those progress reports themselves, whether it's through district screeners or MCA testing, it can be really beneficial for a parent to reach out to PACER advocates to go through that information together. Um, as we had shared previously in this workshop, there are many sources of data to consider when you are monitoring progress, and oftentimes parents have concerns when they do see those district and state assessments or screeners and worry about regression. So if your student is also in general education classes or is a general education student, some other people you could reach out to is your district principal or your local literacy specialist with this, which is kind of something new and related to the READ Act, which is not necessarily or is not special education related. However, sometimes interventions are triggered through those screeners, and as well as there are general education supports sometimes that families just are not aware of that are available to all students, because our students that receive special education services are general education students first. So that's always another strategy that you can use, is to just find out what other types of supports are available if you have concerns with reading or any of those other subject areas.
Another question that came in is, my child with dyslexia is now in ninth grade, general education, and on a 504 plan. How can I tell what they are doing besides report cards? So with 504 plans, there's no goal attached like with an IEP. There's no special education teacher providing services. So I think when you are having questions regarding progress and how your child is doing, it's best to go right to the teacher. So many districts, everything is whether it's Canvas or Seesaw or Skyward, there are all these programs out there that are, the teacher is posting what the syllabus is, what the assignments are for the week, when assignments are being graded. So, I mean, you have that line of communication, but you are also entitled to conferences with high school and middle school teachers. Usually conferences are held twice a year. But if there is an overlying concern that you have in regards to work and progress and just overall how are they doing, you can contact the teacher and ask either for a conference to have better communication so that you can be supporting your student at home. If things are really more challenging, is this the right, does anything else need to be added to the 504 plan to better support the child? Again, now you're in ninth grade. Sometimes it's a different setting than middle school. Our new supports needed to be added into a 504. So it's a lot of things, but you definitely can always start with asking for a conference with the teacher. But with 504 plans, there is no progress reports like there is with an IEP, because with the IEP, the progress report is reporting on the goal, right? The progress of that goal. And so that's what the progress reporting is for. But with 504, that's just not available.
Yeah, I'm glad you brought that up, Colleen. That's a very important difference between the two. I don't have any other questions, so I think you have one more than
I
me.
got one more on my list, and it says, whenever I bring up my concerns, they ask me to show evidence or data, but I'm not there to gather the data. So what can I do? And that's a great question. You're not there. You put them on the bus and you see them when they get off the bus. So a lot of times it kind of goes back to that slide we were talking about other types of data. What do you see? What is your child reporting to you? If your child is nonverbal, then it's a lot harder. Or I know with my kiddos, when I ask them about their day, they'll tell me exactly what they had for lunch, which is what I know that I packed for them. So that's all the information I'm getting as well. So you have to get creative. Again, it's kind of how we talked about, what signs are they showing? Are they saying they don't want to go to school anymore? Is there any kind of that school avoidance? Data is kind of in that aspect. What are you seeing about your child? What concerns do you have? If your child is coming home every day, I hate math, and his hysterical crying and not wanting to even attempt math homework, or okay, that's a big concern. Let's talk about that. That's data. This is, parental instinct is kind of data. What are you experiencing at home in regard to school when you're with your child? Just what behaviors are you seeing? What emotional responses are you seeing when you talk about school? But you also have communication from the school. If you're getting an email from the teacher 2 to 3 times a week that they haven't turned in their homework, or they are refusing to complete math assignments, or they're mysteriously in the bathroom for the whole math hour, so then we know, okay, something is up with math, and I think we need to have a conversation about it. Let's get the case manager and the general education teacher together, or as a whole IEP team together, and have a conversation about it. Is the math too hard? Where are they struggling? Do they need different accommodations? Um, things change as new topics are presented to kiddos, especially as the year progresses. So kind of going from that honeymoon phase from September to November to when now November on, you're learning a whole bunch of new topics. Is it getting harder for kiddos? So you do have data, believe it or not, you do have data at your fingertips. It's more of just that, kind of digging around. What kind of communication are you getting from the school? What kind of communication are you getting from your child? Um, and just kind of getting creative as to what do you have? What kind of support do you have? Um, and all that is data. If you're using an outside tutor, what is that tutor saying? Or again, those outside services like OT or speech, all that can be used as data as well.
Yeah. I don't have a question, but when Colleen was sharing with this last question, it made me kind of think of when families call and they have concerns about a student not making progress. And sometimes we'll review that goal, and let's go back to those behavioral or that emotional regulation goals, which we often see. Sometimes we also help parents kind of look through the goal and look and see, is this goal specific enough? Is it really too vague? Sometimes it's Johnny will show that he can calm down with from receiving adult support to doing so independently. So that's an example of a vague goal. So in order to get better measurement and better progress reporting, and for that student to be making progress, sometimes we have to look back at prerequisite skills, right? So, can Johnny identify when he's feeling upset? Can he identify when he's feeling happy? Does Johnny know how to advocate for help? Does he understand what those supports are that he is supposed to use when he is feeling dysregulated? So sometimes by looking at if a skill specifically isn't listed, and even when it is, sometimes if the student can't perform that skill or it's too vague, we help parents kind of look backwards. Like, what are those prerequisite skills? Can they do those things independently? Because sometimes we just need to back up and think about those things that are required in order to make progress on that goal as it's written. So that's another thing that you can do when you're looking through your child's IEP, is just kind of look at those goals. And if they do feel a little bit vague, you can think about what is something specific that we can state, as well as what maybe needs to happen beforehand if you notice that they're not making really good progress on that goal.
So we got two more that just came in, and then I think we might have to actually wrap it up. But I can take the first one here. It says, when they have not made any progress toward the goal, how can I know that they have been working on it? What besides another meeting are my options? So I think if you're questioning whether or not questioning the progress, or questioning that a special education or related service provider has been working on the goal, one, I would really be looking at the goal and objectives to see, is this something that your child is attaining? Are they retaining the knowledge? I kind of would be digging around to see what more are you looking for? Are you questioning whether or not the services are being provided? You can also ask to see the data. So when you look at your goal, you kind of have the goal, you have the objectives, and then it talks about measurable data, because these goals can't be vague, like Sarah mentioned, and then they don't collect data on it. It has to be measurable. We have to go from here to here. And how are we going to measure that? What can that look like? And is it data collection? Is it teacher reports? Is it para reports? Whatever it is, it will say right on there, how are we measuring this? You can ask to see that data. You can let them know, say, I kind of want to see the data behind this. Can you show it to me? Or show me some work samples. But whatever on that goal, whatever it says, how we're measuring it, that's how you'll know. And that's what they need to be collecting data on is, what is it, work samples? Is it teacher reports? Is it tally sheets? Is it time tests in a 1 month period? Whatever it is, it will say that right there underneath each and every goal on your child's IEP.
Okay, we have one last question, and I'm going to kind of use it to tie up and move into our final slides here. But it says, I'm struggling with this being my kid's first year. How do we really know if she's making appropriate growth? So I feel like our workshop, has been pretty comprehensive in kind of talking about how that appropriate growth is determined by that IEP team. And when it's your child's first year or maybe their initial IEP, sometimes that's really hard to know what is going to be appropriate. This is where I'm going to make a plug for a slide coming up, but where it could be really helpful for a parent when you are new to the special education system, when you're new to the process. It can be really beneficial. And something we always are, it's hard to communicate this to parents because oftentimes we get parents calling us when their problems feel really big and overwhelming. And so these are great questions, even though they don't feel like that's something you would call an advocate for. This is a really great starter point to learn more about the process, learn more about your child's paperwork, how those things go together, how to understand if your goal has a baseline, whether it identifies the skills, whether it has really good measurement criteria. And then we can kind of help look at what those present levels are and what those goals are, and help talk you through those individual things by looking through paperwork. So I think that that appropriate growth is a really kind of an individualized thing, and that's where those PACER advocate services can really come in handy for you. All right. I think I have the next slide. Oh,
Yep.
hang on just a second. Now it doesn't want to move forward. Oh, there we go. Okay.
All right, got it.
Oh, this is a great time for me and Colleen to plug our upcoming workshops. She gets to work with me 2 more times. Our next one, I'll share these with you, but then if you have anything you want to share in addition, Colleen, especially about the summer one, since that one's coming up next.
Mhm.
But we have another workshop called Special Education for Your Child in the Summer. It's taking place at the same time frame, but on March 12th from 12 to 1. That's going to include talking about ESY services, the summer school, and anything else.
Yep. So we'll kind of talk about the difference between ESY versus summer school. And then we also talk about transitions. So again, how I mentioned before, going from building to building. So it's pre-K to elementary, elementary to middle, middle to high, kind of helping parents understand what that transition meeting will look like as a parent who has gone through elementary to middle, and now I'm going through middle to high school transition meetings. I am living the fear with all of you, and I am more than happy to share my tips and tricks of how to survive that 20-minute meeting about transitions. We also talk a little bit about what is available in the summer. So it's not just the ESY in the summer school. We have a couple links to some great community resources, and just kind of how to survive the summer, I guess, is really the best way to talk about it. But those are the things that we'll talk about next week.
Yeah, I think it's also another great time to kind of talk through like what you can be doing in the summer, that's a good time to review paperwork and really start, kind of do some of that hard work that we don't often have time for during the school year. And then our other workshop that we have coming up is called Questions for Parents to Ask at Each Step of the Way in the Special Education Process. So we're hoping to get a lot of questions ahead of time. These are very common areas or parts of that special education process that we get questions about on a daily basis regarding evaluation, eligibility, adaptations, IEP development. I just worked on this morning, but I can't remember the other two. But anyway, we'll give you some really general information on each area, so that you kind of have that base understanding. And then we'll talk through some of those questions that relate to each of those different parts of the process. And that's another time where you can share questions during the workshop itself. That's going to take place on March 19th in the same time frame from 12 to 1.
So please understand that today's workshop is intended as an overview of IEP goals and progress. So feel free to contact a PACER advocate. As we said earlier, can be better. We can talk about your situation and give you options specific to that discussion. To get in touch with a PACER advocate, you can scan the QR code, go to pacer.org. Our phone number is on here as well. We're always changing, updating, and adding new workshops. Today, you sat through one of our new workshops. We got a lot of feedback that Q&A has been a really popular time of our workshops. So we kind of designed workshops around Q&A time. So that's what this week is. And then again, in 2 weeks, but we're talking about question and answers along the way. So we really do take your feedback seriously, and kind of figure out how can we better serve. So please take the time to fill out the evaluation that will pop on as you log off. It only takes a few minutes and it really is very helpful for us. It just provides documentation as well to our to all the grants that we get, showing that we've done our obligation for grant requirements as well. You saw our updated workshops. So with that, I think we did it. We survived a Zoom workshop at home on a snow day with our kids. Congratulations, everybody, and thank you for attending.
Yes, it was nice to have you here. Reach out if you have any questions.
Thank you.